So we were talking a little bit before about macular degeneration, and I understand that there's a special vitamin formulation that may help that particular ailment. Can you tell me about that?
Yes, so there is a large study, one of the largest studies of its kind done with nutritional supplements, and what it showed was that a certain formula of vitamins helped to delay the progression of macular degeneration and helped to delay a conversion from the dry type to the wet type. And that we call the AREDS formula. It's AREDS, and that stands for Age-Related Eye Disease Study. And so there was a first formula, and now more recently the second version of that formula has been released.
Okay, we'll talk more about that in just a minute, but we do have a caller on the line. Hi, Lillian, go right ahead with your question.
Hi, doctors. Thank you for taking my call. My question is, I'm 52, and I have a little bit of diabetes. I don't take insulin, and I do take care of my nutrition with all the supplements you mentioned. But sometimes my eyes have like little sparks of like dark little sparks that goes around. So I'm concerned with that, and I was wondering what kind of test I should request.
Okay. So it sounds like you're bothered by something called floaters. Those are dark little specks that you can see in your vision, and when you move your eye, they kind of lag behind the direction of your eye movement. That's a very common thing to have for just about everybody with time, as the gel that fills the back of the eye separates from the back of the eye. If you have a new onset of floaters, we would want to see you right away, because there can be complications with that separation, like a hole or a tear that can develop in the retina. And in particular, if you're diabetic, we're more concerned about new floaters, not only for that reason that the gel may have separated, but because diabetics sometimes develop new abnormal blood vessels that can bleed. And bleeding in the eye initially will look like a floater or little cobwebs in the vision. So if you have something new, you should come and see somebody who can dilate your pupil and take a really detailed look of the back of the eye, make sure there are no complications.
Great, that's great information. Thank you so much for your call. And if you have a question for either doctor tonight, give us a call at 361-4675. We're talking about nutrition and eyes, and we will have much more with Dr. Beck and Dr. McCabe in just a minute after this quick break. Stay with us. Welcome back to Local Doctors on Call. I'm Candace McEllia, and I'm joined tonight by Dr. Cathy McCabe and Dr. Susan Beck, and we're talking about nutrition and aging eyes. And I just want to remind everyone that our phone lines are open, so if you have a question about any eye-related issue, feel free to give us a call and we'll answer your question live right here on the air. The number is 361-4675. So before the break, we were talking a little bit about the AREDS vitamin combination, I guess, if you will. But will you tell me a little bit more about what the actual, what it does and how it really helps with macular degeneration?
Yeah, the AREDS study.
Yeah,
AREDS study, and it's a formula now. They call it AREDS vitamins as well.
Okay.
Looked at a bunch of different supplements to see what indeed might help the aging eye, especially macular degeneration. And they took kind of the usual suspects: vitamin C, vitamin E, which are, we all know, are good for your body anyway, for controlling free radicals, which destroy your cells and age you and damage your cells. So they also, though, looked at something called beta carotene, which is a nutrient found in plants. And there's maybe about 17 or 18 of them. And that's one of the supplements that they decided to take out and put in different types of, they're in a family called carotids, I should say.
Okay.
And they took out beta carotene because they found that a large amount of beta carotene in people who smoked actually caused lung cancer or accelerated their risk of getting lung cancer.
Oh my gosh.
So they took out beta carotene, and in its place they substituted lutein and zeaxanthine to see if the same family of nutrients would have the same type of benefit. And they found that actually it was more beneficial. And perhaps the beta carotene was even masking some of the benefits that lutein and zeaxanthin did. So the new formula has the lutein and zeaxanthin in it. It also decreased the amount of zinc because they found that a lot of zinc can cause copper deficiency, and some people even say Alzheimer's. So they just cut that to see if the formula would still work with less zinc in it. So that was a couple of things that they did in the new AREDS 2 study, which they started in 2006, but they've just come out with all the information on it.
So that's all pretty new information. So a lot of patients have been on the AREDS 1 formula, the original formula. And now when I have patients come in with that formula, I try to educate them that things have changed. We've known for quite a while that beta carotene wasn't something that we wanted to give patients who are smokers. So even with the original formula, we had alternatives that didn't involve beta carotene.
Now, isn't that what's in carrots that people say is good for your eyes?
So beta carotene's in carrots, it's in orange vegetables, like sweet potato is another classic vegetable that we think about having a lot of beta carotene.
It would probably be hard, though, to eat your way to overdosing on beta carotene. But if you're taking a supplement, it's good to leave that out if you are or have been a smoker.
Okay, interesting.
So, a lot of times when they have these studies that this is bad for you and that's bad for you, it's really hard to...
You have to think about that rationally. It's not like if you're a smoker, you want to avoid all carrots now. But it's not what we're saying. Just high doses of beta carotene is not good for smokers, and not on a daily basis, which is what the supplements would involve. So, but having carrots in your stew, that's perfectly fine.
Yes.
Okay, very good.
And they also added some omega 3s into the new formula as well. But that's something, and that again relates to the essential fatty acids that help our cell walls and just help keep our health of our cells and our eyes.
Anti-inflammatories.
Yeah.
So they help with all kinds of inflammatory conditions within the body. Omega-3s are a very healthy thing for lots of different things, not just the surface of the eye and macular protection. So one of the really great things to take, although there has been some recent data out for men looking at a link between omega-3 fatty acids and prostate cancer. So we're going to be rethinking some of those recommendations for men anyway.
And I think probably most, like anything, it's in moderation, right? And it's depending on your particular
needs and risk.
Exactly, and that's why it's so important to see your doctor and discuss it.
Yeah, so much better to see your doctor. I have a lot of patients today who are somewhat educated that there is a vitamin supplement that's good for macular degeneration, and they've started on their own taking some supplements and don't really have any macular problems. And now those patients who are either men or smokers may be actually doing themselves a disservice rather than helping with the health of their body. So,
absolutely.
So yes, doctor's guidance is always a good idea.
Better to be proactive.
Omega-3s and vitamin E, if you take too much of them, they're also a type of blood thinner. So they're good for you, but they thin your blood. And if you're on any type of medication or even just a daily aspirin, you do want to consult your primary care physician to make sure you're not overdosing on your blood thinning, because people then come in with bruised, I see bruised arms and broken blood vessels in their eyes, and it turns out that they're taking vitamin E and fish oil, and they're on Coumadin and an aspirin. So
definitely
it really can go awry if you don't
keep loading on yourself without some guidance.
This is fascinating. We're talking about nutrition and your eyes and health and how they're related. So if you have a question about nutrition and aging eyes, give us a call. Our phone lines are open, and the number to call us is 361-4675. And the doctors will answer any eye-related question. It doesn't have to do with just nutrition. So don't be shy. Just eyes, right? Exactly. Not nutrition. We're talking about nutrition and eyes. So we were talking about the omega-3s, and that kind of brings up the whole fish oil question too. We were talking earlier about the different types of oils, vegetable oils, fish oils. What do you think as far as vegetable oils? How is that related to eye health?
Well, vegetable oils actually are not really the best type of oil you can cook with, because vegetable oil is a catch-all oil. It can have palm oil in it, it can have corn oil in it, it can have soy oil in it, and none of these are very good for you. They contain a lot of what's known as omega-6s,
Okay.
and unlike omega-3s, omega-6s actually cause chronic inflammation, and they interfere with the omega-3s. So we want to try to stay away from that type of oil. The best type of vegetable oil, if you will, would be a canola oil.
Okay.
And that actually is a lot more healthy for you. It contains omega-3s, and it's the best type of oil you can cook with, as well as olive oil as well. And like I was saying about the omega-6s, how they, unlike the omega-3s, are not so healthy for you. With our American diet, a lot of processed foods that are frozen and packaged and prepared and come from restaurants and takeout, they contain a lot of omega-6s. Okay. And our diet has gone from a 1-to-1 ratio of omega-6s to omega-3s to about a 20-to-1 omega-6s to omega-3s. And again, that causes a lot of chronic inflammation. So if we can stop the get more omega-3s into our diet and less of the omega-6s with, the, like I said, the prepared foods and the vegetable oils, then we can be on the road to better health and better healthy eyes.
What about people that are on prescription medicine already? Is that something that they should consider when they're thinking about taking a nutritional supplement?
Absolutely. For some of the reasons that Dr. Beck already talked about, as far as if you're on blood thinners or aspirin, you want to be careful about taking omega-3s. There are certain medications that interact poorly with other supplements, and so it is always a wise idea to contact your primary care doctor and just ask their advice.
Okay, great. Well, we have a caller on the line with a question for one of our doctors. Hi, Bob. How are you?
I'm good.
Oh, I don't think that's Bob. Barbara. Sorry about that. Go right ahead with your question.
Are you asking for Barb or Bob?
No, you, Barbara. We
Barbara.
had your name wrong. We apologize.
Okay,
What question do you have?
I'm curious about what you have to say about the krill that is now on the market, and also with omega-3s. Is krill better for you
Sure.
than just the straight omega-3s?
Right. Yeah, I have a lot of patients who are interested in taking krill oil, and primarily, and this may be why you're interested in it too, Barbara, is because those pills are a lot smaller, and they're easier to take and to swallow. And as long as it's a good, high-quality omega-3 fatty acid, then it's really a good supplement. It's just hard to know what you're buying sometimes.
Yeah, they're not regulated.
Those nutritional supplements are not regulated, and it's really sometimes it might be an advantageous thing to ask your doctor if they have a particular brand or a particular type that they know is of good quality.
Yeah.
Yep.
So when would you advise patients to start on vitamins or supplements? Would you say get involved early and start taking these supplements, or really just eat a healthy diet? I mean, where do you draw that line?
I think eating a healthy diet is always, step one. And the eye supplements, like I said, they can supplement your diet, places that you might be lacking. If you don't think that you're going to have the best meals this week, maybe you want to be more attentive to your supplements.
Sure.
And for sure, if you've been diagnosed with early type of macular degeneration, cataracts, that you're on the path for problems down the road, and supplementation is good. But again, it's not going to substitute for a bad diet. And also, people have to realize when they do take supplements, it's part of their medication list, so to speak. So when people ask you what medicines you're on, if they forget to mention all the supplements that they're taking,
That's a good point.
that can be a problem with their regular medications or over-the-counter medications as well. So it's important to mention that always to their physician, what supplements they might be taking.
And I think it's important to remind our viewers too that I know at the Eye Associates you do a lot of free seminars all the time. You do free cataract seminars weekly, and I know from time to time you'll have even vitamin seminars.
That's true, or dry eye or certain subjects. So yes, we do.
People should definitely check out the website.
Absolutely.
All right, so thank you so much for joining us. This has been such great information. We really appreciate it. And we've been talking about nutrition and the eyes tonight. If you have additional questions and you didn't have a chance to get your question answered live on the air, definitely call up the Eye Associates or check them out online. They have free seminars all the time for cataracts, vitamins, nutrition, all sorts of great things. And if you missed any part of tonight's show, it will re-air on Sunday at 10:30 a.m. Thank you so much for joining us, and for all of us here at SNN Local News, and for Dr. Beck and Dr. McCabe, have a great night.